Before transitioning your baby to sitting up in a stroller, it's crucial to ensure that they've mastered two key milestones in order to ensure that they can do it safely. To help you make this transition, I'm going to walk you through what these two key developmental milestones are, and then we'll talk about how to check to see if your baby is ready. First, in order to ride safely while sitting up in a stroller, your baby needs to be able to hold their head steady without it flopping forward, backwards, or to the sides. And this is known as head control. This skill is essential for several reasons. Proper head control allows your baby to breathe comfortably in the stroller. Without it, their head may slump forward or their chin could press against their chest, potentially blocking their airway. Good head control also helps your baby adjust their head position in response to movement, ensuring a comfy and safe ride. And finally, adequate head control indicates that your baby's neck and spine are strong enough to hold their head upright, preventing strain and reducing the risk of injury. Head control is a milestone babies typically achieve sometime between 3 to 4 months of age, and this is just one of the many exciting developmental milestones your baby will achieve during their first year of life. I've created a free guide that shows you when you should be expecting certain skills and when to be concerned, and you can grab that by clicking the link down in the description. The other key skill they need is postural balance. This is your baby's ability to maintain a stable, symmetrical position whether they're slightly reclined or upright. And this skill plays a crucial role for several reasons. With proper postural balance, your baby can stay comfortable in the stroller, avoiding excessive leaning to one side. If a baby leans too much to one side while seated in a stroller, it can lead to multiple safety concerns. One major issue is the strain on the neck, spine, and joints, as excessive leaning can put undue stress on your baby's body and potentially cause discomfort, pain, or even long-term problems. Breathing can also be affected if the baby doesn't have adequate postural balance. They may slump or lean too much to one side in the stroller, impeding their breathing by compressing their chest or actually causing their chin to press against their chest. And in some situations, the stroller harness might actually press on the baby's chest or neck, further restricting their airflow. Finally, there is a risk of entanglement and injury. A baby who leans excessively might accidentally become entangled in the stroller harness or other parts, potentially leading to injury. By achieving good postural balance, your baby will be better prepared to adapt to any movements, bumps, or sudden stops that they may face while seated in a stroller. And this helps to reduce the likelihood of falls or injuries. Now, to test if your baby is ready to transition to a reclined stroller seat, you can perform two simple tests that assess their head control and postural control. To check your baby's head control, have them sit on your lap with your hands gently supporting their rib cage. While they sit with your support, watch their head movements and posture. If your baby demonstrates good head control, they'll keep their head steady without shaking or wobbling their head. A steady head actually means their neck muscles are strong enough to hold their head, lowering the risk of injury when they are sitting in the stroller. Their chin should also not be touching their chest. Instead, you should see a visible gap. If your baby's chins rest on their chest, it's unsafe to use the stroller in an upright seated position, as there's a risk that their head will actually fall forward or their chin will press against their chest, obstructing their airway. You should also notice that your baby can maintain a straight head position even when you gently move them from side to side. If they can keep their head steady and in line with the center of their body and prevent it from flopping around when you do this, then they have the strength needed to hold their upper body and head upright when they're seated in a stroller. To check your baby's postural control, you want to place your baby in a slightly reclined position, and you can achieve this by sitting them in a bouncer seat or helping them to sit up while sitting on your lap. And when they're sitting, you want to carefully observe their body posture and alignment, paying attention to the way their head, neck, and spine align. If your baby displays good postural control, you should notice the following. Your baby should be able to maintain a balanced, symmetrical position with their head, neck, and spine aligned properly. This indicates that they have the necessary coordination and stability to sit comfortably in a stroller seat. They should also not be leaning excessively to one side. A balanced posture ensures that your baby will be able to remain secure and at ease in the stroller seat and reduce the risk of any potential problems that may arise when they're sitting in the stroller. If your baby passes these two tests, you can transition them to a reclined stroller seat. But before you jump in and do that, make sure you watch this video next, because in it I'll walk you through how to set up your baby stroller seat with a step-by-step guide covering everything from determining the perfect seat angle to positioning the harness straps and providing foot support for your little one.